in the field of pain research in general, there's this dichotomy, or there's this contrast of opinions. As anybody would knows, when you have pain, you can localize where that pain is, right? And specifically, we're talking in Aivo, we are really specifically interested in back pain. So you know it's in your back. There's no confusion that it's there or not. So it's a very bodily oriented suffering, in a sense, of a condition. But that creates a very simple idea that, well, if it's in my back, all I need to do is fix my back and this pain will go away. And in fact, that's been the fundamental scientific position in the field for the last 50 years, in fact. Now, we also all agree that that any sensation or perception is something that happens in your brain, right? Listening to my voice is something that the sounds are coming into your brain, and your brain is interpreting that into something that you understand as language, and make some sense out of what the nonsense that I'm talking about, in a way. So then the dichotomy is, especially for chronic pain, the dichotomy is, do you treat the back or do you treat the brain? What is the critical component? Because the pain, just like every other sensory modality, is obviously perceived and interpreted in the brain. But one could also say, my pain is in my back, so I need to treat my back. On the other hand, even that perception that it is in your back is a brain perception, right? It's a mapping of your body location into an area in your brain that says, it's in your back. So it is also possible that, just as possible, that the brain is a fundamental parameter in this chronic pain state. And in fact, for the last 20, 25 years of our research, we have continuously generated evidence that, first of all, the pain, once that moves away from being an acute state into a chronic state, is far better understandable from brain properties than from the injury site properties. Okay, so that's a big important distinction. So what, in a sense? One would say, okay, big deal. So what? The big deal is that, pharmaceutical companies have spent about $50 billion in research dollars trying to come up with treatments for chronic pain. And all of them are basically trying to cure the back rather than the brain. Okay? And they have miserably failed. We have essentially no new medication that's specific for chronic pain that has been developed by pharmaceutical companies, even though they have huge resources, huge tools, massive amounts of research opportunity. It just hasn't happened.